There are new breakthroughs happening in medicine every single day. How will they affect you? Well, today we're wading through some of the hottest topics in the health field with Doctors Carmela Sebastian and Srini Iyengar. Great to have you both here.
Great to be here.
Thank you. I love doing the doctor panel because the first hot topic is placenta encapsulation.
Yummy.
What is it? And why are new moms giving this a try?
This is a really interesting topic, especially because, as you guys know, my wife is 5 months pregnant now,
Yes.
and this has become a topic in our household. We've been looking online and seeing what is exactly placental encapsulation, or eating your placenta. Basically, it is literally that. After the baby's born, ingesting the placenta, usually after it's dried out and put into pill form, and this is supposedly to give the mother a boost of energy or lack of depression, or to overcome lack of milk production. There's a lot of attributes to this type of thing, but it's not scientifically based.
Okay, so Dr. Carm, is this just a bunch of bunk?
Well, you know, I have 2 children.
Yes.
I have no intention of eating anything that has to do with them, even food they make at home, let alone
Right.
the placenta. So there is not 1 ounce of scientific evidence to support this. In addition,
What about anecdotal evidence?
And that's saying, this is important for everybody watching too. There's a lot of anecdotal evidence, but it could also be the placebo effect.
Right.
You know, when people
Yes.
feel they're eating something that is so out there that
Right,
this
yeah.
might be something that, hey, this may give me my own body's energy back, all these
Yeah.
you know, thought behind it. The fact of the matter is it's more anecdotal, and it's more, again, placebo related until there's proven evidence, which we
Right.
don't have.
Could it be dangerous?
Yes, and that's what I'm very concerned about. Generally in medicine, though, to tag on to what Doctor was saying, anytime someone says, I took that 1 pill and it either made me feel wonderful or made me feel horrible, you have to think twice about, you know, what else is going on there, because usually 1 pill can't do it.
Right.
However, when the placenta is taken and it's prepared for the capsule, a lot of preparers, because there are professional placental preparers, try to say that 3 times quick, actually put herbs and other substances in the capsule, and people are having bad responses to that.
Okay, all right, so
And
ixnay on the placenta.
I would say, and there's
eating.
even blogs of spouses eating the placenta with the
Yes.
wife. And listen, I'm a vegetarian, so
Yeah.
I'm going to pass on
So
that.
you're going to pass, but your wife might not. We'll see. We'll wait and see. All right, can using sunscreen affect a man's semen count? This is something that we're hearing about now.
At this point in time, we've seen more and more evidence saying that UV filters, or the ingredients in sunscreen, can affect a male's ability to produce, have children. But to be honest, there's so many variables when it comes down to sperm production, or even having reproductive ability, which is smoking being the biggest one.
Sure.
You know, making sure, you know, what I tell a lot of patients too, and what I've talked to my colleagues about, is that we're always so worried, like, I'm going to have a child soon, my wife is, and we're basically saying we're focused on the child, but we need to focus on the individuals having the child, you know?
Absolutely.
Your own health first.
Absolutely. And, you know, this article that mentions the sunscreen talks about what the real issues are, and that is, you know, how we take care of our bodies generally. We need to try to keep of a normal weight.
Yes.
Because people who get heavier, especially women, it's very difficult for them to conceive. We need to not smoke. We need to eat healthy. We need to watch pesticides, things like that, that we know have been linked to issues with fertility.
So don't throw away the sunscreen.
No, not at this point.
All right, now let's talk about white coat hypertension. Okay, if you've been prescribed a blood pressure medication based on a single high number at the doctor's office, you may really want to ask more about that and find out if you need it, because high blood pressure can be caused by just running up the stairs to get to your doctor's appointment. If you're in traffic trying to get there, your blood pressure can go up. Blood pressure goes up and down all day, so it's normal. So when the doctor says your blood pressure's high, I have to put you on these pills, what do you do?
Your blood pressure actually goes up at that point, I can tell you, because most patients are upset by hearing that, you know. But I'll tell you the truth is, this is such a common phenomenon. We have, and no joke, I actually don't wear a white jacket in the office to tell them, see, let's see what your blood pressure is like, as to take them off their, hopefully, anxiety level. Because a lot of times patients come into the office anxious, rushing in from traffic, trying to make their appointment. And let's be honest, no one likes going to the doctor's office a lot of times, because they get bad news most of the time, or some of the times they're hearing something they may not like.
Okay.
Yeah, and I'll tell you, I don't get too excited being around physicians because I've been around them quite a bit. However, we do a health fair at work. And I run, as you do, a very low blood pressure.
Right.
Well, I had just been at the gym. I ran up the steps to get into, and it was a little high. Well, of course, at that point, it went even higher. So it can happen to anyone. And it is your body's natural ability to protect itself that when you, at certain times, you need a higher blood pressure.
So what's the answer? Do we test ourselves at home?
So, Cindy, that's exactly So what I tell every patient that comes in the office with high blood pressure that they say, I'm anxious, I was rushing in, I say, listen, I'm not going to put you on something right now, but I want you to go home, and I want you to get a home blood pressure kit, which you can get at any over-the-counter place. Check your blood pressure twice a day, once in the morning, once in the evening. Write it down, and please be honest. Be honest with your physician, and call me in a week. And if you see that top number over a certain 140, 150, call me, because then we know it's not me, it's your body.
And it's easy to do it at the pharmacy as well.
It is. It's very easy.
They're everywhere. Just put your arm in and check it yourself. Okay, the U.S. Food and Drug Administration has approved an implantable device for treating obesity. The surgical implantation takes about 60 to 90 minutes, and it's usually done on an outpatient basis. Do you think this is a good alternative for people who are maybe afraid of gastric bypass?
There's going to be a small number of people for which this will be very helpful, but it's going to be a small number. The criteria for this is even higher or harder to get than that for bariatric surgery. So the BMI is a little higher, 40 to 45. And, you know, the issue with this is you don't want to say to someone, just get that implanted and forget about exercising and forget about eating properly, because all of that is so important to the whole body.
Obesity is an epidemic in this country, and we have to be cognizant that a device or pill isn't going to be the quick fix. This is good to have. It really is, because there's going to be patients out there that are going to need something as an alternative to surgery, major surgery like gastric lap band or sleeve. But again, we want to kind of you put the proviso that, listen, diet, exercise, talking to your physician first and seeing what are all my alternatives rather than jumping on the Johnny-come-lately type of device.
Definitely. Dr. Carmela Sebastian and Dr. Srini Iyengar, great to have you here.
Thank you.
And Jerry, over to you.
Do you have pain or swelling or restless leg syndrome? Do your legs bother you, in other words? Well, all of this can be easily fixed by treating your varicose veins. Dr. Jamal Wozni from the United Vein Centers is here with lots of good information and advice for us. Dr. Wozni, nice to see you again.
Thank you.
Let's talk, first of all, a lot of people at the end of a day say, oh, my aching legs, my dogs are killing me, they have all these complaints about their legs. What is this due to? Is it simply just being on your feet all day?
It is being on your feet all day, but we mistakenly feel that what's happening is that we're getting old, we're just getting weak, we're getting tired. But what's happening in most patients is that they have underlying varicose veins, and these veins dilate and start holding blood as they're standing all day. Kind of like a waterfall, the blood falls into the legs and sits there. Well, as it's sitting there, the legs start to feel heavy and subsequently tired. Blood is mostly water. Water is heavy. If you pick up a bucket of water, it's pretty heavy. And that's what your legs are going to feel like at the end of the day. Similarly,
people say, oh, I've got a Charlie horse problem at night. I get awakened by this cramp in my leg. What causes that?
Many times patients will feel their potassium is low, and they'll come to the office and say, doctor, I need to eat more bananas, or I need a prescription for potassium. My legs are cramping. Well, a lot of times, these patients, when you do further investigations, you will find again that they have varicose veins, and these veins are holding blood. What actually happens is at night, after holding blood in your legs all day, and your legs are laying flat, the blood starts to come out of the legs. Once it starts to come out of the legs, because they're elevated somewhat, the muscles start to twitch and cramp.
So a lot of times people might go to their normal doctor who won't necessarily diagnose varicose veins, correct?
Correct.
So they obviously have to come see a specialist.
They will have to come see a vein specialist. Now the good news is there are a lot of primary care physicians out there that may be aware of this, and on many occasions we have received the referral of a patient who has had the cramping, they've tried, the primary care physician has tried the potassium.
Will a primary care physician, doctor, will they refer a patient to someone like you?
Yes.
Or do they, oh, they will?
Yes.
Okay, good.
Yes.
Good,
Yes,
because Because I would think a lot of them say, well, you know what, it's just you're getting old, you know, like you said.
Well, these days, varicose veins and their treatment is becoming more prevalent. It's known more. So we are noticing over the last, say, 5 years that more and more primary care physicians are aware of venous disease.
So what happens if you don't get your varicose veins fixed?
If you don't get your varicose veins fixed, and there's a picture we can refer to with the first stage being the varicose veins, the bulging veins, and then that will lead to what we call chronic or sustained swelling with the pooling of the blood in your legs. This will then, from all this pooling, you'll start getting some darkening of the skin and hardening of the skin. And then the last step is ulcerations or breakdown of the skin.
It looks bad.
From all of the pressure over the years on the overlying skin, and the lack of nutrients to that skin will cause it to break down.
And it's a simple fix, isn't it?
It is a simple fix. We use lasers these days, and basically what we're doing is putting a laser fiber in these bad vessels, and we're zapping them closed with these state-of-the-art medical lasers.
All right, Dr. Wozni, good information. Now, there are 2 United Vein Centers, one in Largo, one in Tampa. For more information on the upcoming free screening, take a look at your screen. Be sure to call the number 844-VEIN-FREE or go to the website. Thank you so much, Dr. Wozni. Always a pleasure to have you.
Thank you.
All right, we'll be right back.